Hello, we are here to review our HH Wound Care Resource Manual. This resource manual has been put together to make information more accessible to our bedside nurses. The resources and information provided in this manual are to be used as a guide. Any complex situation should be addressed with the provider and/or your wound care specialist for guidance and clarification. Other resources available are our policies and procedure, as well as our Elsevier, which is our procedural manual for Homestead Hospital. It is important to note that we do have hard copies of this resource manual in all of the units. They are located in different locations, so for my float pool, I do recommend that if you need to use this manual, to please ask the PCS or clinical educator for that unit to where that location is. For SSU, we have it above the cabinet, above the sink in the nurse's station. So the cabinet above the sink in the nurse's station is a bright lime green folder. It is the same color for all the units, so just look out for that lime green colored folder. All right, it is important that you know that you can refer to this if you have a question on any dressing type, device, or treatment. There are also QR codes available in the binder for nurses to view videos on the different types of equipment that we have, as well as use as patient education references. So we will then go through the LearnSpark to touch base on everything that is included in the resource manual. Our physical resource manual was uploaded to this journey by Araceli. So if you go into LearnSpark and you type in the search box wound care, it will be the first one that comes out. It'll have here the pictures of our wound care management team. Once you go in there, you will have the different sections. So as you see here, we have a pressure injury prevention. It'll go over our workflow wink as well as our Q-turn clock, Braden score and capture camera, pressure injury staging, prevention products such as our Percuity bed. There is a video included in here of that. Pressure injury treatment guide, our wound care dressing protocol, ostomy care QR codes for videos on how to apply pouching and all of that, and then our polar ice therapy, wound vac application, Tubi grip application wink, and then lastly our wound care team and additional resources. If you hit expand all here, you will be able to go through all the different things we have. So we have here the wink on our process for pressure injury, so it'll tell you what you do on admission as a ED nurse, as an admission inpatient nurse, as well as surgical services. There's also a handoff communication section, handoff where you can go here and make sure everything has been done for that. We have a PowerPoint that goes through our Q-turn clock as well as the clock there to be used. There's an AM and a PM clock. So if you're going in through LearnSpark, you can click on the link or on the different section that you want to review more closely, and then the PowerPoint, if it's a PowerPoint and one of the flyers, will come out and then you're able to read through here. You can also tether through this using the little arrows on the side. Okay, so I will not go through it in depth, but this is for you to know how to look at it and for you to do it in your own time. Make sure that you please review this. It could be reviewed as the hard copy or the online version. They both include the same thing. So it is important that everyone is familiar with what's available to them as a resource, so that in case you ever have any questions, you can refer to it and have that information at your fingertips. Okay, there's also here a section on documenting your Braden scale and how it relates to interventions that you can add as an inpatient, how to do your capture camera on your SpectraLinks. All right, there's some staging posters in here, the video on your Percuity bed. There's also an overview on the different devices that we carry, like our waffle cushions, the overlay, the waffle overlays, the TrueView boots. Okay, we also have guidelines on how to replace devices for prevention of medical device-related pressure injuries. And then there's also a product overview, so you know what is available to you in the Pyxis. Sometimes we don't have it in our nearest Pyxis, but sometimes we have them available somewhere else, so it's important for you to know what we have. Okay, then we also have a pressure injury guide. This one's great. It kind of gives you that overview of when you have a certain stage, what you would do next. Sorry, I already went through this one. So see, if you have a stage 1, it kind of gives you an identification of it, and then your prevention treatment. Remember, if we have a pressure injury, we should be adding our power plans, and it will prompt you. But this one also has the pictures of the certain devices, not just the name, so that is also very helpful. Okay, let's see what else we have in here. Another one that I thought was interesting was this wound care dressing protocol. So if you haven't done a specific type of dressing in a long time, this is a guide on how to do the different dressings that can be ordered. Remember, we always need a doctor's order to do anything. So for all your wounds, you would follow this protocol of cleaning, prepping the skin. Then here you can walk through, and then if it's a packed wound, it'll give you a little guideline of what you would do, what to dry dressing, what to moist dressing. So it is definitely very important that we, if we're not familiar with something, it's important sometimes for us as nurses to read a little overview of what we should be doing. So this section here I found extremely helpful. Okay, so we also have our Ostomy Care QR code. So we have it in Spanish. We have the different products we carry, the videos to walk you through if you haven't done an ostomy change in a little bit. All right, and then we have more videos here, and then the Ostomy Care and Supplies. There's a little PowerPoint here, a little overview on that. We have the polar ice therapy, so a walkthrough on that. And then we also have a breakdown on wound vac application. So for maybe our newer nurses who are not as familiar, you can go in here and it'll walk you through the process of your basic application of wound vac. Another one that is important is when we're filling out that wound vac form for our patients that are going to be going home with a wound vac. This form here kind of tells you what areas should be completed by a case manager, by the surgeon, and by the nurse. Kind of gives you that highlighted portion as a reminder of what should be done by whom. Then last but not least, we have a little overview at the end of your wound care management team, pressure injury prevention, as well as links to the Homestead Hospital policy and procedures. Okay, remember to review this in its entirety via through your LearnSpark link, which I will add to the email where I sent out, as well as or your hands-on manual that is in SSU for you to review. If you have any questions, please let me know. And then there will also be a virtual sign-in link for REDCap. It will be your sign-in will be under HH Wound Care Resource Manual. Once you've reviewed it, you go ahead and you sign in there. This education will be due by the end of September. Thank you, and please let me know if you have any questions.